And new research finds that feeling lonely can be as harmful to your health as smoking. Now, some health experts are wondering if the same strategies used to cut tobacco use can help tackle the growing isolation epidemic. And here with us this afternoon to dive a little deeper into this is Dr. Tyler Prochnow. He's an assistant professor at Texas A&M University School of Public Health and one of the health behavior experts behind this commentary. Doctor, thank you so much for being with us.
Thanks for having me. Really appreciate it.
Okay, so social isolation can be as bad for your health as smoking 15 cigarettes a day. That's a heck of a comparison. Why is it so important for people to understand this?
So I think it's really important. So for individuals that smoke, you may already know those health risks, right? We've documented that for a number of years. But not as many people know the health risks, and not just social health, but physical health risks of feeling lonely or being socially isolated.
Well, you say that your research shows more than 1 in 5 people are actually socially isolated, yet it doesn't seem to get the attention that other public health issues get. Why is that?
So I think there's a number of different reasons that might be. One of it being there's still some stigma around feeling lonely, about talking about loneliness, about talking about social isolation, and really fighting that. And then the other side of it is it's, you know, it doesn't show up as a rash, or some of the symptoms may not be the same for one person as someone else. So we don't necessarily see it as that big of an issue, or we don't really identify it all the time.
Now, I know a lot of people will use social isolation and loneliness and think it's the same thing. How are they different?
Yeah, there's a small difference, but I think it's a really meaningful one. So when we talk about social isolation, we are talking about the absence of social connections or social participation or social interactions. But the other side of it is loneliness is that feeling that we might get when our level of social connections aren't meeting what we would like to see or our needs. And that can be in size, our function, or like what we go to our social networks for support, or even just our emotional closeness or how close we feel to the people around us.
I know a moment ago you talked about the symptoms. Can you tell us what those are?
So one thing that I kind of liken this to a little bit is when we think of nutrition or when we eat. So when we think of social isolation or social connections, it might be just the simple food, and you know, there's better quality food than others, where hunger might be that loneliness. So it's that feeling inside. Maybe you are feeling, it's very similar to maybe feelings of depressive symptoms and things like that. So maybe you are feeling like you want to withdraw, or maybe you're just feeling a little sad, or you know, you're not meeting those needs. So it's really that feeling that triggers or that says, hey, something's not right here. Maybe we need to focus there a little bit more.
Well, what lessons from the fight against smoking made you think that those same strategies could work to fight or combat loneliness or social isolation?
One of the biggest things is the overall robustness or just comprehensive nature of our smoking prevention programs. So if you think about from a national government level all the way down to local, from our TV ads all the way down to how we have created spaces and we have made smoke-free spaces, all of those things, and just the concert of that and how we need to approach social isolation in a similar, maybe systematic approach. And maybe that is the same that we need to do here for a more complex issue.
Now, I know you also talked about even having possible warning labels or age-based limits. What would something like that realistically look like in real life?
Yeah, we are looking into that. Some people say in other countries are also doing that, and this is specifically looking at age restrictions for social media. And that was one of the things that really came around about that. And we're seeing how some of the most detrimental effects from social media may be on our younger populations, our adolescents, our teens, things like that. So Australia has set some age restrictions about how different websites can advertise to or host users of different ages, seeing how that works. The other side of it is when we looked at how tobacco was fought originally, a lot of the lawsuits and the punitive damages from that went into the tobacco fund, and that funded a lot of the resources that were smoking cessation programs, helplines, quit lines, things like that. That could be done very similarly in some of our social connectedness and how we are looking to better our social media approaches.
Good ideas. And Finally, for somebody watching right now who feels socially isolated, who feels that terrible loneliness, what's the single most important thing that they can do, the most important first step that they can take today?
I mean, that's a great question. We could have a weekly segment. I've got so many of them. But at any rate, the most important thing is to fight it with action. So when you are feeling that, a lot of times you would want to withdraw, just like I was saying, those symptoms of depressive symptoms, and you don't want to reach out. But I'm going to challenge everyone here watching. Our next commercial break, go ahead and reach out to someone. Reach out to someone that maybe it's a friend or family member that you haven't talked to in a while, and just check up on them, showing a genuine care for them, for what they've been doing, and maybe set up a coffee time or a drink or whatever it might be. But fighting that with action, you can just not only help your own health, but help their health in the same text.
Good information and advice. Dr. Tyler Prochnow with Texas A&M, thank you so much for being with us.